Hi, my name is Shaniqua, and I'm going to be talking about clinical judgment and applying it to a patient with chronic illness and having diabetes. The first thing I would do is recognize cues, and this can range from a wound that's not properly healing, uncontrolled blood sugars, extremely high, extremely low, talking to the client about how they feel after meals, also them saying that they feel fatigued would be a cue. And to manage this, I would first start with diet, see how their diet is, see if they can modify any activity, are they exercising, food habits. If I needed to, I would talk to a doctor about possibly increasing or decreasing the insulin if they have anything, even just medication management. I can also talk to a dietitian that can really sit down with the client and give them better education on certain foods to eat, maybe making a food list of healthy snacks, and start there with modification of the diet and exercise before we go to the medication. And then once we make those changes, we would definitely make sure that the blood sugar is being regulated and monitor that regularly. And if it reflects that the sugars are at a better range, then we'll know that these changes are working. Also, we would assess the wounds to make sure that the wounds are healing correctly, because this can lead to serious complications, being that diabetics have poor wound healing. So I would start there and just, constantly educate the clients and make sure that they are aware of how important it is to take their medications, to eat healthy, and to exercise. Thank you.